Good evening, everyone, and thank you for joining us for CAPA's Health and Wellness series. This is a second in a series of 5 webinars that we are hosting. We are very, very excited this evening to have Dr. Humberto Choi, who is going to be presenting on health and wellness, smoking and vaping, and cessation. Dr. Choi is a pulmonologist with the Cleveland Clinic, and he's also the medical director for the Cleveland Clinic Smoking Cessation Center. He's going to be highlighting the effects of smoking and vaping and tobacco and the impacts of smoking and COVID. I'm going to turn it over to Dr. Choi now, and thank you again.
All right, thank you, Kelly, and thanks for putting these webinars together and for the invitation. I think this is a great opportunity for us to connect with the community. And my impression that you guys did a great job, because I've been walking around and I see colleagues of mine who live in Brecksville, and they know that this has been going on, and everyone seems to be very excited about it. So just a little bit about myself. As Kelly mentioned, I'm a pulmonologist, but I also work in the ICU. I've been here at the Cleveland Clinic for a little longer than 10 years. And I work mostly with patients who have lung cancer or have spots in the lungs that could be cancer. And I also work in the medical ICU here at the Cleveland Clinic at main campus. And one thing is to work with patients who already suffer the consequences from smoking. And I think part of that is a focus on prevention. And I think that's why we're doing this session. And that's why it's important for me to talk about smoking and vaping, so we can spread the word. And hopefully this is something that can help someone out there, if they hear something that resonates with him or her. So, by the way, if you have any questions, please feel free to use the Q&A feature. If you look at your Zoom in the bottom, you should see like a feature for Q&A. So if you have any questions, if anything comes up, feel free to send a question there, and then I'll keep my eye on that, and I'll answer right away, or we can leave for later in the presentation. Okay. So the first part is like, why is tobacco so dangerous? Well, we know that a cigarette can contain several chemicals, not only the cigarette itself, but also in the smoke when that cigarette is burned. And you see here a list of things that you can find in a cigarette smoke. For example, acetone, cadmium, formaldehyde, lead. And you can see here all the things that these things can be found at. For example, a nail polish remover. So imagine all these substances that someone is smoking when they are smoking a cigarette and putting that into your lungs. And we know that when a cigarette is burned, it creates more than 7,000 chemicals, and some of them is really hard to know how they affect the lungs, but several of them we know that are associated with the formation of lung cancer. So, we wonder if we know that something has those chemicals, like why we'll be using that, knowing that they can be very dangerous and harmful to the lungs. We know that smoking causes several deaths each year from affecting multiple parts of the body. As you can see here in this graph, smoking can affect virtually almost every organ, like from strokes in the brain, from different forms of cancers, especially involving the airway, but also increases the risk of having infections, increase the risk of having complications from pregnancy, among several other problems that can be connected to smoking. So this is what I work with. So I just want to show this just because sometimes it's very difficult to explain what things are just by words, but when you see it, it makes more sense. And if you have any questions about these things, please feel free to send a question to the Q&A. Just type something there. So you see here on the left, this is a CT scan. And if you can see my arrow here, you can see the right lung, and all these dark spots here that look black. This is actually how emphysema looks like in the CT scan. The areas that look more gray, this is actually normal lungs, and everything else is just emphysema. Imagine basically the cigarette smoke just destroyed the lung tissue, and then we have all these several pockets of air. And when you look here at the picture on the right side, you see here how it looks like in the actual lung. You can see here the change in the color. There are several like dark areas in the lungs, and all these other pockets that almost look like holes in the lungs. So, and this is how it will look in the CT scan. People always ask like, how bad is the emphysema? One thing is how the lungs look in the CT scan, and the other one, how the lungs work. So we see how severe someone's emphysema is when we combine information from a CT scan like this to a lung function test. So like if there's any concern of someone who has COPD or emphysema, yeah, then we would typically do a lung function test to see how much of these changes are affecting someone's lung capacity. Now, this is the other thing that I work with. So this is another form of CT scan. You can see that there are smaller dark areas here. This is emphysema in the lungs. But now here in the right lung, in the lower part of this right lung, we can see this mass. And this mass has like a very irregular features, what we call spiculated. So knowing that someone had a history of smoking and has this mass that looks very irregular, has this speculation, this is something that is very suspicious for cancer. And in this case, this is how it looks, when someone had a surgery and had their lungs removed. So this is how the cancer would look like in the specimen that is removed by surgery. But these are like emphysema and lung cancer. These are the complications of smoking that I work with. And so that's why it's important for us to talk about prevention. Like one thing is doing procedures to diagnose this and giving treatments for this, but we don't want that. We want to do something to help prevent so these things don't happen. Now, this is an MRI. This is an MRI of someone who had lung cancer, and you can see here the spine. And these dark gray areas, this is just a sign that the lung cancer has already spread to the spine. And this is how it looks like in MRI. And this is an MRI of the brain. So this is a brain like in a slice, and this round kind of oval area, this is like a big metastasis in the brain. And why am I showing this? Because unfortunately, right now, when someone is diagnosed with lung cancer, odds are we detect that in a very advanced stage when someone already has metastasis, like spreading of the disease to different areas. It can be liver, it can be spine, it can be in other parts of the lungs, but also here in the brain. So again, one, we want to prevent the disease by promoting education to help people quit smoking. And when it comes to that, we also recommend screening for lung cancer. This is something that exists now, and this is by doing CT scans every year for people who are at high risk for developing that. But none of that will be necessary when we help someone to quit smoking. So we can prevent all of this stuff, all the emphysema and the lung cancer, the spreading of the disease, the concern of having something in the brain when we help someone quit smoking. Sometimes the chance of that doesn't go down to zero, but it gets very close to zero when someone quits, especially when they quit for a long time. So sooner you quit, more of the benefit from quitting smoking you will have. Now, this is something that you hear often. as soon as you quit, there are things that will happen to your body immediately. And longer you quit, you see more of the long-lasting effects from quitting. Like immediately, when you stop quitting, that smoke is not irritating the body anymore. Is not You're not putting those toxins in the body anymore. So the body automatically begins repairing itself. And often we'll see that someone's heart rate or even blood pressure gets better because the nicotine does that. It can accelerate the heart rate, it can increase someone's blood pressure, and we see that effect when someone quits smoking. And then we'll see that, like for example, when someone has a blood test, we see that the levels of carbon monoxide will begin to drop and eventually go back to normal. Within a few months, we see that the lung function and the circulation in general will begin to improve. A lot of people say that, they notice that the cough that they had for a while eventually gets better. They're a little less short of breath. And often, I will say one of the most common things that I hear, especially when someone smoked several cigarettes, that the sense of taste and smell gets better, and food tastes better. So these are the things that can happen, when someone quits from weeks to months. After a few years, those are the most long-lasting effects that we worry about. There is a decrease in the risk of having heart disease, a decrease in the risk of having stroke, a decrease in developing forms of cancer, like in the lung, in the mouth, in the throat, in the esophagus and bladder, because most of these cancers are very strongly connected to smoking. And when someone quits, the risk of having these cancers goes down significantly. Now, all these issues are for, like, in general, for people. But when one person decides to quit, one, you're saving money. You know that cigarettes are expensive. And when someone, for example, is smoking one pack a day, if you multiply to 7 days a week, to 4 weeks, and 52 weeks a year, that's quite a lot of money. So, there is a financial gain that you have by quitting. People will always say they feel better, as I was mentioned before. The sense of smell and the taste begins to get better, and and the things around your house and your clothes will also won't have that smell from cigarettes anymore too. And you'll see that because there are so many restrictions now, it's getting less and less convenient to smoke. I think people be more conscientious about smoking along other people. If you quit, you don't have to worry about if you're exposing your family or friends to secondhand, which is one major cause for lung cancer as well. People begin sleeping better. And just like I said before, the food begins tasting better because your smell begins to get better too. Now I'm going to switch to vaping, but if you have any questions about cigarette, please feel free to put something in the Q&A. So vaping is something that you probably heard a lot in the last year, like in 2019, when we had a really bad outbreak of lung injury, lung inflammation associated with vaping. Especially because the prevalence of vaping increased significantly among teenagers, and young adults, people in high school and college, and young professionals, because that's exactly the public that these companies were targeting. So you see here in this drawing that there are different kinds of vaping. I think we hear a lot about this type here because of the common brand, but it can come in different shapes. It can look like a cigarette. It can look like a USB drive, and you have this other shapes and forms. And if you want more information about how these things work and what's the difference on how people use this, feel free to send a question. Now, similar to regular cigarettes, we know that the electronic cigarettes have very harmful chemicals that are also present in cigarettes. For example, formaldehyde, that we know that is something that is called that associated with cancer, and acrolein, that's something that is used as a weed killer. It can also cause lung damage. So so there are several chemicals that are similar to cigarettes, or some that are just unique for electronic cigarettes, that we can find in the e-liquid, that liquid that people put in their device, or in that vapor, what is emitted after that liquid is heated. Now, it's important to know that the chemicals that you find in these electronic cigarettes can vary. One thing is when someone uses electronic cigarette or vape that has a brand, and you see the ingredients, but often it's not like that. A lot of these devices can be manipulated. People can add and mix with things that sometimes is really hard to detect, and we don't know exactly what they are. And sometimes they can be very, very harmful, especially because we don't know exactly what is contained in these devices. And it's not only nicotine that sometimes it's in it. Sometimes can be CBD or other components from cannabis that can be found in these devices. So there are several things that make it challenging to determine what exactly was the cause for the lung injury or lung inflammation. Now, as I was saying before, this is very concerning. In 2018 to 2019, like 1 every 4, every 5 students in high school said that they at least try to use cigarettes, and several of them would say that they did try in the last 30 days. So these numbers, of course, are very concerning. And to see that almost 5% in middle school already try that. So this is a huge red flag, because this is something that is not only creating the possibility of creating lung inflammation in such a young age, but it's also the time when their brains are developing. So the risk of having nicotine dependence and causing an addiction so early can be very serious in someone's development. Now, the nicotine is the main thing that we worry about when it comes to vaping in such an early age. As I was saying, the brain in someone young is still developing, and over time it can affect learning, it can affect memory, it can affect someone's mood. So it can be associated with depression, for example, and anxiety, and that can be connected to that addiction to the nicotine. And now, like, who are they targeting? So most of the numbers we see of vapors are among very young people. And I don't know if you guys followed a news last year or 2 years ago. So when there were a lot of articles about that, the companies would say, no, we are not doing anything to target their young people. But there are several clues that they are. They are using flavors that are like fruit or candy that are very sweet. They have several ads that offer a discount or a cheaper value for that, because they know that young people don't have money. And they will use pictures of very young people in social media. They will use magazines that are targeted to young people to put their ads. So, for example, like this, this company specifically would say that they are not targeting high school students or teenagers. But if we see an ad like this, I think it's very clear, what the public that they are trying to target. It's certainly not our grandparents that they are trying to target when they have an ad that looks like this, that is colorful, that involves this concept of fun and a party with young people. So we have to be very conscientious about this kind of message that these companies are trying to send to very young people. And unfortunately, it has been very successful based on the numbers of people who are experimenting and getting addicted to these devices. And this is what it shows. This is what has been happening with smoking in general over the years among high school students. You can see here the line in blue and gray. Sorry, this is cigarettes. All these lines slowly seem to be coming down, but exactly like 3 years ago or so, when these electronic cigarettes became very popular, there was this boom. So there is, despite everything else being decreasing over the years, there was this big push for electronic cigarettes, and they have penetrated the high school students. So, and we are seeing this prevalence going very high in a very short period of time. I'm sure if you have anyone at home that is in this age, I'm sure they know someone who is using or has used a device like that. So what are the health risks? One is the nicotine addiction and how this can impair someone's learning, concentration, memory. In the short term, these devices can cause inflammation in the lungs, and this inflammation can be severe enough to cause death. And this is something that we saw when we had that outbreak. There is this possible increase of risk of infections. This is very clear with cigarettes, that we see that when someone smokes cigarettes, there is a higher risk of having infections. And now something that is unknown is that long-term effects. Like, we know the risk of cigarettes for years and decades, and electronic cigarettes, vaping, is something very new. So we still don't know exactly what would be the long-term effects. Like, does it cause emphysema? Is this associated with cancer? So this is something that we don't know yet, but this is something that is still a reason for research, and something that we are learning more and more. There is evidence in very basic science research, like in labs, that there are mechanisms that vaping can be associated with emphysema or cancer. We just need to see if this is something that will translate in disease in people who use that. And unfortunately, it will take some time for us to determine if that happens or not. Now, other effects, nicotine itself can be toxic for someone who is pregnant. It can affect the development of the baby. So it isn't a good reason for someone to quit. So in general, nicotine, coming from a cigarette or electronic cigarette or vaping, should be discouraged when someone is pregnant. I see a question here: can smoking affect fertility? Yes, people who smoke would tend to have more fertility issues compared to people who never smoked. And this is something that can also affect not only the mother, but can also affect the baby when someone is pregnant. I'm going to just take a look here at the chat just to see if there's any question. Sorry, I can't see this.
Dr. Choi, there's a question about somebody who quit smoking 14 years ago, and they just worry about the long-term impact.
Turning black?
The long-term impact, like the long-term health impact
of
somebody who quit smoking 14 years ago.
Okay. Yeah. So first thing is, the best thing that you did was to quit. And longer you quit, more of the benefits you have. unfortunately, something that will happen, that history of smoking, will always be there. So the chance of having a problem from smoking, unfortunately, I can't say that it goes down to zero, but it will be much lower, and over time it will be closer to the risk of someone who never smoked. But the chance of not having any problem at all, unfortunately, it doesn't evaporate, but it does go down significantly, especially the risk of developing cardiovascular disease and the risk of developing cancer from smoking. So I don't know if I answer your question, but if I didn't, but please send a message to the Q&A, and I'll answer again.
Just one other quick question, Dr. Choi.
Yeah.
Somebody who quit smoking by using vape, but they're not convinced that it's better for that person to have, quit using vape.
Yeah. So I'll answer that question in a second. So now I'm going to go back to what I do. So these are the patients that I'll see in the office here at Cleveland Clinic. So again, these are CT scans, and we see these areas here, these shadows. These are spots of inflammation. So this is something that happened when someone started to vape, and we see these spots, these white spots. So this is inflammation. This looks like a pneumonia, but it's not an infection. It's just inflammation that inhaling the vapor can cause in the lungs. And all we had to do was to, help that person quit smoking. And this scan, after just a month or two after quitting, they just went away. So this is just an example of those effects that vaping can have in the lung that are short-term, and they are typically inflammation. And the most important thing is to quit, is not to vape. And a lot of these things will just get better on their own. This is another thing that is real. This is what we call pneumothorax. The lay term for that is lung collapse. So if you see here in this X-ray, here on the top, everything looks a little more black. So this is air. So this is something that we can see with vaping, and also when someone smokes pot, when they're smoking marijuana, that we know that this is associated with a pneumothorax. It can cause lung collapse. And what happens? We have to drain that air out. So if you see what happened to this lung collapse, we had to put this chest tube inside that area with air to suck the air out to allow the lungs to the left lung to re-expand. This is another version of that. This is a more severe way that it presented. You can see that here in this X-ray, all this part here is black, and this is just because it popped air and the lung collapsed. And when we did a CT scan, this is how it looks. All this black is air. So this is what happens, when the lung collapses. And this is something that we had to treat with chest tube, and even require surgery to fix that. So unfortunately, this is something that I see. I won't say that I see every day, but it's something that I see often. And it's another example of those short-term effects. It doesn't matter if you were vaping or using pot for years or just a few days. Those are the effects that someone can have, even if you use once or twice. And this is the other extreme of that. So this is that severe lung inflammation that can be caused by vaping. And this is the thing that that brought that attention to that outbreak. So this is a CT scan of someone who had severe inflammation because of vaping. All the darker areas is actually the normal areas. In this CT scan, everything that looks light gray and white, this is actually the inflammation in the lungs. And if you see here on the left, this thing here is the tube. This thing here is a tube. This person had to be intubated because the inflammation in the lungs was so bad from vaping that they couldn't breathe. They were very short of breath, and this affected so much all over the lungs that that someone had to be in the ICU and intubated on life support. This is another version of that. You see here on the right, all this haziness. This is inflammation from the vaping. This is not the same person's scan, but it's just to show how the lungs should look like in the CT scan. In this scan on the left, these are the normal lungs. On the right, this is what happened in that extreme version of vaping causing inflammation in the lungs. See how much different it is when the lung is inflamed by vaping. So looking at all these things, you know, I know I'm often questioned a lot and even pressure to say that vaping could be safer than cigarettes. But when I'm dealing with these issues with lung collapse, with inflammation in the lungs that can be so severe that puts someone in life support, you know, how can I endorse something like that and say that it's safer than cigarettes? The honest answer is that this is something that we don't know. The things that we know are the short-term effects. Yes, it can be associated with inflammation, and that can be so severe that can threaten someone's life. Now, the long-term effects can cause cancer, emphysema. That is unknown. So we don't have an answer for that. Now, we have to take that into consideration when we advise someone whether they should use vaping to quit smoking, because that person needs to know that there is a risk of those things to happen if they vape. There have been studies looking into electronic cigarettes as a treatment to help someone quit smoking. And there are several studies like that, but very few that are very high quality. And one of the best studies show that it did help some people to quit, and it was better than using a patch of nicotine patch. The problem was, after a year or so, the people who were using electronic cigarettes were still using electronic cigarettes. And in the group that quit just with other treatments like a patch or when they quit, they were not using anything else. So although the electronic cigarette helped a lot of people, they were still using it. So it didn't completely take them off the nicotine. It just maintained the dependence on nicotine, but using a different device. So right now, it's not one of those treatments that we recommend to help someone quit. We typically use the ones that we know that, one, are effective and one, are safe to someone, and just a matter of how we manage those medications so people don't have side effects, and having a way that we can help deal with how to change someone's life when they're quitting because it's difficult, and managing the medications at the same time. So let me see. Meredith, do you mind just reading those questions for me?
Sure. So one of the questions was, do lungs recover from quitting vaping, or are they permanently scarred?
Can you say that again?
Do lungs recover from quitting vaping, or are they permanently scarred?
Good question. So the slide that I show here, so this is an example that someone had inflammation from vaping, and they just had to quit, and the lungs go back to normal. So it does depend how severe the inflammation is. Now, when we get to something like this, like on the right side, you know, it's common to leave a scar behind. And often these people, when they are out of the ICU, they are very debilitated. And when we check their lung function, some of them may have their lung function reduced because of inflammation. But when it gets bad to this point, yes, unfortunately, it can leave a scar behind. And sometimes this scarring can be very severe too. So unfortunately, yes, it is possible to have a long-lasting, permanent damage in the lungs from vaping.
And then one of the other questions is that, is there such a thing as secondhand vape? My husband vapes a lot. Should I be concerned?
Yeah, so this is something that we don't have a lot of studies about. All the information about secondhand vaping comes from cigarette smoking, and especially when it's related to lung cancer, because we know people who live in houses where people were smoking for years or decades, they have a higher chance of developing lung cancer, for example, in the future. We don't know that yet for vaping, but the vapor can have chemicals that are harmful. So the answer, it's possible, but we don't have good information about that yet, because it is something new. Now, something that I'll say is that the vapor sometimes has a very strong scent, especially when they have flavors, and the vapor can be very dense. So I often see patients who have asthma, who have COPD, or allergies, who are very sensitive to things that are in the air or around them. So, I have treated patients with asthma attack, like an asthma exacerbation, that was triggered by being exposed to that cloud from vaping. And something that happened, even like when someone went to Indians game, someone was vaping close to them, but they had asthma, and then once they were in contact with that cloud of the vapor, they had a asthma attack right there. So I'll say it is one way that that secondhand exposure can affect someone. Is there another question, Meredith?
No, not right now.
Okay, thank you. So what about COVID? I think it's almost impossible to talk about lung health and not involve COVID. I was saying before that cigarette smoking, we know that is associated with increased chance of infection. Smoking does impair the immune system and increase the chance of someone acquiring, for example, pneumonia, tuberculosis, or having more bronchitis. And we know now that there's also a chance of having a worse clinical course of COVID-19. So I know this graph is complicated, but this is just showing multiple studies showing similar thing, that when someone smoked and had COVID-19, the disease progressed in a more severe way. They had worse outcomes compared to people who never smoked. Like, looking at the results of all these studies here in the last number here, this star here is a number 2. This means that the smokers had 2 times the chance of having progression of COVID-19 that was severe compared to people who don't smoke. So yes, COVID-19 is also involved with this. So this is information from cigarette smokers. Now, we don't know yet about people who vape, but I wouldn't be surprised if we see similar studies showing similar results in people who vape. And another question that we have is, can someone transmit COVID-19 through the smoke and or from the vapor? So this is also an unknown. I'll say it's possible. It would make sense because the vapor is in the air, but we don't know if that could be a mechanism of transmission yet. How can I quit? You know, there is no one way to quit. You know, everyone has different health issues that we have to take into consideration. Everyone has a different living situation that we also have to take into consideration. Now, when someone needs help, we do have a smoking cessation program at the Cleveland Clinic. This involves different departments and institutes in our hospital. For example, we are the Respiratory Institute, where we have nurse practitioners and physician assistants who can see patients. Same thing in our Cancer Institute or Chronic Care Clinic or in Akron. Our pharmacists, there are pharmacists that are primary care pharmacists, and they also do visits for this. We have the e-coaching who can help patients with behavioral support, giving guidance and tips when they're trying to quit. So we have a multifaceted program involving different departments, so the different ways that we can help someone quit. This is something that we try to do when we see a patient who wants to quit smoking. One is combining, a visit with one of our clinicians. It can be a doctor, a nurse practitioner, or a physician assistant, because we are the ones who are handling the medications, seeing what health problems someone might have, and see what would be the best approach when it comes to a prescription for that person. But after they leave our office, then we connect them with support. And this support comes with the e-coaches. The e-coaches, and by the way, this behavior support lasts 6 to 7 months, is actually free. And these e-coaches will be in contact with our patients by phone or via email. And after they get their prescription, they help, guide them on how to use them and give tips on how to manage a cravings and sometimes side effects. And if there is any problem, then they will connect back to us. And when we have this combination of having a clinician involved with your care, with behavior support, yes, the chance of quitting is much higher. Meredith just sent me a question about, I think someone asked about teenagers when they're ready to quit smoking. So, we also see patients of young ages. Now, and that's why it's important to connect with one of our clinicians, because there are certain medications who are not approved for teenagers. So we just have to take into consideration their age, and depending on how severe someone is addicted to nicotine, that we can help manage in different ways. And sometimes can be a combination of different nicotine, a patch or a gum, to help alleviate some of the withdrawal symptoms that someone can have when they quit smoking. And someone asked if they can get a nicotine patch or a gum when they're under 18. The answer is yes, but there are other medications that are not fully approved for people who are underage. Sometimes we use them depending on how severe someone is addicted to nicotine, but overall, it's more like the nicotine replacement approach. Just for to know, you probably saw in this presentation that I posted our website, and if you go to our website, you see some information about our program and about the benefits of quitting. And you see here on the top that our appointment number is there. This is a voicemail that you can leave a message. But if you click here also and sign up for the program, it takes you to this page, and you can just put a little bit of information, and one of our coaches will contact you to sign up with our programs and have a visit with one of our clinicians. There was a question here about nicotine replacement therapy and what it is. So this NRT is a method for to treat tobacco dependence, and just like any addiction, the body does get dependent on nicotine. So it means that when you stop that exposure to nicotine, the body will miss that. And that can cause withdrawal symptoms that can be being very anxious or sweating or having even headaches, and sometimes can be even nauseated. So it can be very difficult for someone to just quit cold turkey because the body will have the chemical dependence to the nicotine. And then what we do give the nicotine in different ways. And it can be a gum, it can be a patch. There are even sprays or inhalers with nicotine. But the most common ones are patches, gum, and lozenges. And the most effective way is to have a combination of those. For example, a patch and a gum, or a patch and a lozenge. And this helps to alleviate the withdrawal symptoms, a little bit of the craving. And we see when people use that, the chance of quitting is much higher than just trying to quit on their own without any form of treatment. There is a misconception that this is something that can only be done for a few weeks. This is not true. This is something we can use as long as necessary. You know, it's better to use a gum for a long term than to continue to smoke for a long term. It's a good question. So this is my last slide. I know that it may not make sense, but this is the message. You know, this is a painting from Monet. I'm pretty sure people heard about him. And I think often people think that these famous artists, they are so good that they put something like a masterpiece like in one take, and they're able to put something beautiful like this just because they are so good. It's like magic, it just happens. But it's really not like that. And even Monet, he would recognize that. You know, he really wanted to transmit into his work what he felt when he visited those places. So he tried once, he tried twice, dozens of times, until he was able to achieve his goal. And he had to find some mistakes, make some corrections. And you see there, sometimes he even had to destroy some of his work because he hasn't achieved his goal. And I think we can see this message also for smoking. You know, it's okay to try more than once. Sometimes we have to restart. We have to see what we can change, what we can twitch a little bit, and then until we get to our goal, which is to achieve abstinence. So, you know, it doesn't have to be all at once. It doesn't have to be at the first time, but, you know, we're going to be committed with you to help you quit. And we just find different ways, try different things, restart, try new things, or try things again until we are able to finally quit for good. So this is my last message. Happy to stay longer if you have more questions, and we can have a conversation about this. And Meredith, if there's any other questions in the chat, feel free to read.
Yeah, I don't see any currently. I actually did have a question though.
Okay.
Have you guys seen any more cases of, and I'm probably going to butcher the name, so bear with me, but the EVALI, like the lung disease that comes from vaping? I know that was for a while, it seemed like there were cases popping up, especially in our teenage population. Mm-hmm. So have you continued to see cases of that, or is that kind of tapered off?
Okay. Yeah. So since that outbreak in 2019, the prevalence has decreased in general. And some of the public health strategies have worked because, and I think there has been more knowledge about vaping, although vaping is still very prevalent. This has decreased. Now, unfortunately, because everyone has been so consumed and busy by COVID-19, we actually don't have more statistics about that because everyone's effort has been dedicated to COVID-19. And something that for us is very challenging is when someone develops that EVALI, which is that lung inflammation related to vaping, the history and how people present in the CT scan and how much that affect their lungs is very similar to COVID-19. So sometimes it can come looking at it in the same way, because what we see is similar in that CT scan, seeing both lungs being very inflamed. So it can be difficult to distinguish what is just vaping and what could be COVID-19.
Great, thank you. One other question that just popped in: are the flavorings in vapes dangerous?
Yeah, so the flavorings themselves are being studied to see if they are dangerous or not. Some of the flavorings can have chemicals that can cause inflammation, but the major problem with the flavoring is that they are the main reason that a lot of people are attracted to vaping, because young people don't like that flavor from the nicotine that can taste a little sour, can taste bad. But if it tastes like a pineapple or strawberry, that's how they try it. And once they try it, they have the nicotine, and that's what brings them to being exposed to something like that. And in surveys, and when you ask anyone what was the reason that they tried or why they keep using that, they'll say that, well, it tastes good, it tastes like ice cream, it tastes like bubble gum, so it is what attracts them. So removing that factor would actually deter a lot of people from trying a vape, because vaping just with the nicotine actually doesn't have that sweet taste that the flavors can bring. All right.
Yeah, I don't see any other questions, so thank you so much.
Okay. All right. Well, thanks again, everyone, for attending, and thanks, Kelly, again, and everyone from CAPA and the community of Brecksville. I hope this was a helpful session. Feel free to go to our website and see some additional information there. Okay. And if you have additional questions or concern, I think you can communicate through Kelly Lazar as well. Okay.
Thank you, Dr. Choi. It was really wonderful. Really appreciate all the great information, and I'm sure we are going to be sending this out. So I'm sure we're going to get more questions, and I will I'll definitely forward that to you. But wonderful information.
All right. Okay, guys. So this was great, and thanks again, and have a good night.